Good afternoon and welcome, everyone. Thank you so much for joining us today at the 2020 virtual Fairfax County Public Schools Mental Health and Wellness Conference and Inova Act on Addiction Summit. This webinar series would not be possible without the generous support of Joan and Russell Hitt. Before I introduce our speaker, here are a few housekeeping notes. All participant lines have been muted and everyone's video has been turned off. We will be taking questions via the Q&A feature and they can be submitted at any time. That feature is located at the bottom of your screen. We will do our best to get to as many questions as we can. Our speaker today is Nhat Nguyen. Nhat is in Adult Behavioral Health Outpatient and Case Management Services at the Fairfax Falls Church Community Services Board. Along with his family in 1975, Mr. Nguyen arrived to the U.S. as a Vietnam War refugee. After transplanting to Virginia, he completed his undergraduate in clinical psychology from George Mason University and then obtained his master's in social work from the Virginia Commonwealth University. He has worked in various settings serving adults and youth with serious mental health, intellectual, and/or substance use disorders. Take it away, Nhat.
Thank you so much, Shelby. Well, thank you for inviting me. I really feel honored to be part of this process. This event is phenomenal, and I hope the audience will have the same opportunity to get something out of it. I mean, hopefully it's not going to be just another day of getting information without any substantive use out of it, right? All right, so I'm going to go ahead and start with my screen share. Okay, I'm not seeing it. Okay, let me switch display. All right, Shelby, is it just the slide, the presentation slide, not the presenter notes?
Can you switch back?
Oh, sure. Is this better?
Yes, that's better. Thank you.
Okay, great. Thank you so much. Again, so today we're going to be talking about addiction process and how to disrupt the reward system. So I entitled this When Enough is Enough, Disrupting the Reward and Addiction Process. All right, so hopefully from this, the learning objectives that you'll leave with having a better understanding of what the addiction process is as it responds to the recovery circuitry, reward circuitry, that it's a biopsychosocial disease model, and some intervention approaches that we might be using in our care as well as in the private sector, and other resources that might be available to you at your disposal. Sorry. All right, so if I can ask you to go ahead, if you have another device, if you can just sign into this website. It's www.menti.com, and then enter the code 7629567. Okay. And I really appreciate, excuse me, Megan, for putting all the instructions in the chat. So if I say something you don't hear it or what have you, please check your chat, and then that way you can be able to follow along. All right, so I'm going to show you a couple of pictures, and I want you to just jot down the first feeling or the first thought that comes to your mind. You know, some people think and some people feel. So I want to give you that option in terms of what you see, what thought may be evoked or what feelings may be evoked, okay? All right, so here's the first picture. So go ahead and type in what you might be feeling or seeing or thinking from what you're seeing. And I'm gonna screen share the Menti website. Great, relaxing, warm, beach happy, paradise, serenity, I saw that bouncing around. So it seems like relaxation is the biggest word that is associated by this. So I really appreciate what you guys are doing. Let's go back to the other slide. Okay, and some people may be summer people, they like hot weathers. Some people may not be. So what do you guys feel or think when you see this? And let me go ahead and go back to the other site. Okay. Peaceful, serenity, cold. Okay. And again, not too surprising, the biggest word that comes out is relaxing or relaxation. Excellent. All right, let's go to this next picture. And as we approach the holidays, this is what comes to my mind. And let's see what you guys think or feel. Happy. Stress, that's an interesting one. Family. Gratitude. Okay, great. All right, great. Thank you so much for indulging me with that. And I wanted you to get a sense of what addiction might be. Obviously, we're not addicted to summer. We're not addicted to the winter. We're not addicted to, well, we could be addicted to food. But in this example, we're not addicted to food. And for most of us who don't have addiction, we're not going to understand a person who may have addiction. So I was hoping that from these images, it would evoke some feeling or thought. And usually those feelings are positive feelings. And so that's what we kind of have to understand what addiction is. And this is the definition of addiction. Addiction is it's a chronic disease of the brain, reward, motivation, memory, and related circuitry. Just like you were noticing that your presenter view is showing. Sorry, let me swap this again. All right, is that better? Okay, so obviously we're looking at how addiction works, and because it is a brain circuitry thing, that there's a pairing between our behavior or experiences to the act. So the summer beach, you guys felt relaxed, you felt warm, you felt sunny. Those are all traits that's associated with the beach. Likewise with winter and Thanksgiving. And addiction is that we have that substance which create an emotional response, and that becomes tied into our brain. That's what that circuitry talks about, is that it forces us to remember the good things. Oh, I'm still in presenter mode, sorry guys. How about now? This better? Still no? Okay, let me change something. How's that?
There you go.
Thank you so much. Sorry for the technical issue. And I'll take the blame because I didn't want the support team to take on the responsibility of advancing the slides. So I goofed up. But let's go back to the addiction and what the definition is. So if you can remember how the picture evoked certain feelings or thoughts, the drugs and the substances. And when I talk about drugs, I want to make sure we also understand that alcohol is a drug. So if I don't say alcohol and drugs, just include alcohol as part of the drug word. So that's where it gets tied into the whole process of addiction. There's a memory component to it. So what makes us feel good, we're going to remember. I mean, that's the whole principle of pleasure, right? As animals, we don't want to experience negative feelings or hurtful feelings or negative experiences. So we tend to go toward what makes us feel good or what's pleasurable. Now, addiction becomes problematic when it causes us to have a pathological, so it's something that's unhealthy, pursuit for that reward. And then there are some that are seeking relief by using these substances. And other behaviors, and we're not going to talk about behaviors because this is behavioral is a process. Today's focus is going to be more of a chemical addiction as opposed to the process addiction. An example of a process addiction, if you're kind of curious about that, is like shopaholics, workaholic, sex addict, gamblers. So those are process addiction as opposed to chemical addiction. And then without treatment or some form of engagement in recovery activities, addiction will progress. And because it's a disease and it's chronic, it can also lead to death. Okay, so let's keep that in mind. All right, so here's a really nice picture that I found that I want us to kind of see to understand what addiction happens and how it occurs. So the basal ganglia, which is the blue portion of your brain, that is the reward circuitry. So what that does is the drugs starts to activate the neurons in it. It makes it excited. It creates this euphoria, and our body, our state of being, we like to be kind of at a nice steady place. So our brain will work to go back to that equilibrium, okay? And then over time, as we continue to bombard the brain with substances, the ability to kind of go back to equilibrium becomes better, more effective, and therefore the effect of that drug or substance becomes less potent. So that's when we would be developing tolerance, and we would want to increase the dosage to get back to that same euphoria. I'm sure for most of us, we can relate that going to the beach every summer may not be the most ideal. We may change it up because we get kind of bored. That's what tolerance is. And, you know, it's that we are overexposed and it's not as exciting anymore. Then when you move from the basal ganglia, you go to the amygdala, and that's where the stress circuitry is occurring. That's when you feel stressful, and it will evoke senses of anxiety, irritability, unease, and these are the negative feelings that we want to try to escape from. So that when we are in that phase and we know, well, the drug will make that go away, it's the quickest way to make it go away, I'm going to use that drug again. So there you can start seeing that the pairing of the good behavior, or not the good behavior, I'm sorry, of the behavior of using drugs and alcohol to replace the negative feelings. And then over time, that pairing makes it becomes a habit, right? And then here's the challenging part, the prefrontal cortex, where we have the ability to make rational decisions, think, and so forth. In the beginning, we might be able to fight off the urges to use or the urge to repeat. Oh, I got a question. Can I repeat that habit? Okay. So in terms of a habit, when we are pairing the substance to the desired effect, so we're taking something into our body to make us feel better, because let's say the amygdala is dealing with some stressful situation. Here's a prime example. Right now, most of our kids are probably doing distant learning. They're working from home. So you have more people at home when maybe they're not supposed to be. You got people working remotely. So the stress of that kind of adaptation starts to build up. And some people might resort to substances to alleviate the stress. When you continue to pair the response to a stress by ingesting substances, and over time, as your body acclimates and become tolerant of that substance, you continue to either increase the frequency, increase the dosage of the substance to get the same desired effect. Over time, that becomes a habit. And that's what habit is that you just automatically go to that behavior as a response to whatever stimuli it happens to be. And over time, that prefrontal cortex becomes less effective at telling us to not do that, to be able to see the negative consequences of drugs or alcohol, and to help us guide into a more appropriate choice or decisions, right? All right, so let's continue, and you're welcome. All right, so this is just how our brain works. So in our normal, while we're, there's neurotransmitters floating between the synaptic gap and the dopamine. You guys probably have heard of that, and that's the one that really gives you the sense of euphoria. Eating food, you can see there by illustration how much dopamine is being released. So that's how pleasurable it is for us to eat food. When you're using cocaine, and this is again an illustration, you can see how much more dopamine is released in our brain. So the magnification of that pleasure is so intensified that the behavior of people to repeat the use of cocaine in this example will be much higher than people eating. Obviously, we eat to survive, but some people will forfeit the pleasure of eating so they can have the pleasure of cocaine. So that's the important thing in terms of where and how powerful cocaine or any substances for that matter affect. And for some of us who may not be able to relate to, again, drug use, because maybe we've never used drugs, including alcohol, if you can think about the best meal you've ever had, and the pleasure you receive from eating that meal. Now, if you multiply that experience by 1,000 or 100,000 or even 1,000,000, that's the experience of the different types of drugs or alcohol may affect us. I mean, I don't want to necessarily tell you that one drug is less potent than another drug, or one drug is worse than another drug, because then it creates somewhat of a value statement that, hey, it's okay, it's just marijuana. It's okay, it's just alcohol. It's a phase. They'll go through it and it'll be done. And that may be the case for some, but that necessarily is not the case for many. So that would be a concern that, an experiment leading to a misuse, leading to abuse, and then ultimately dependency. So another question came up is, what do I mean communication is denied? I'm not quite sure what that is. I'm not sure what the question is. So if you want to rephrase that, I'll be happy to try to answer that. Okay. So some of the characteristics of addiction is the inability to consistently abstain. All right. Another characteristic is the impairment of the behavioral control. So for example, you guys tell me if you think this is problematic. If I know somebody who drinks alcohol, never had been arrested, continues to work really well, but counts his or her bottle caps to make sure that once they hit 6 bottle caps, that's it, they stop. And then if they get to 6 and then they continue to use, but don't collect their bottle caps. So you see what I'm getting at? That becomes the tricky part of our own brain and how we can try to manipulate our behavior to make it so that we get what we want. So there's another question that just came up is, how does this translate to gaming? That's a really great question. And actually, the DSM-5 is what we use, and DSM stands for Diagnostic Statistical Manual. It's kind of like our Bible for behavioral health, and it outlines different disabilities or disorders with the different conditions that a person needs to demonstrate or have in order to be diagnosable, right? To be, I guess, in some word, certifiable. In terms of gaming, the DSM-6, we are getting some previews that gaming actually is going to be on in that, and it talks about as the DSM. Well, they're actually in the process of working on adding gaming as a process addiction. So it will be coming out if it's not yet already been forecast. So we'll definitely see more of the criteria, but I wouldn't be too surprised some of the criteria fit the same criteria of addiction, whether it be a process addiction or a chemical addiction. Because if you think about what these characteristics, you know, inability to consistently abstain from playing, right, or impairment in behavioral control. Let's say they set their time for 30 minutes, but then they go 2 hours later, they finally come up to eat or what have you. The craving of the behavior, diminished recognition of the significant problem with one's behavior and the interpersonal relationship. So it's not my problem, it's your problem. You know, I don't have a problem with alcohol. I don't have a problem with drugs. I don't have a problem with gaming. And I'll use gaming as an example right now. So it must be your problem that you're having this conniption, right? And then dysfunctional emotional response. Dysfunctional meaning is something that's not appropriate to what's going on. It's not healthy in terms of an emotional response to what's going on. So that's some of the characteristics of addiction. And again, I want to challenge you guys to kind of think of what it might look like if it's not just chemical, right? All right. So here's the slide that I like to use, which is to show what a control brain might look like under a PET scan versus a brain that is using some kind of substance. And I would be very excited to see if they do the same kind of comparison with people who are involved in process addiction, whether it be sex addiction, whether it be gaming or what have you. So you can see the normal brain, or the column on the left has the coloration of the blue is your brain, the yellow is the activity that's happening, the red gives it more intensity in terms of what's happening going on. So if we're thinking, we're doing some activity, that's when the brain starts to activate. That's what the red and the yellow represent. So when you're using any of these substances, cocaine, for example, let's look at the top one. There's no red, meaning there's no brain activity. It's just all about the effects of the drugs. You're not thinking, you're only feeling. And then you can see the other brain example, the MRI of the different effects of substances. Some of the things that, you know, as parents, a question that's often brought up is it reversible? And for adolescents and the teens that are using drugs and alcohol, it is reversible if it can be stopped early enough. And I don't want to sound too negative or scare anyone unnecessarily, but you know, there's a point to which our brain's elasticity, ability to kind of bounce back, starts to diminish. And if you see the example with the methamphetamine, the second brain down from cocaine, you see there are black holes in the blue area of what the brain should have. So there's actual structural damage to the brain itself. So there's physical damage to the brain. So to kind of bounce back from that, you're not going to be at 100%, but you might be able to get to 90%. So that, I want to paint the picture that, you know, people can recover from drug and alcohol use and not feel like, oh, it's a death sentence and might as well just keep going at it. So another question just brought up is, does medication have the same effects as drug? If so, can it be reversed in adults as well? And the quick answer is yes. I mean, any substance that we put into our body has a chemical reaction, right? Medication that we're taking is to either increase the supplement of whatever's being missing or limit the overactivity of our brain. I'm just going to use an example, and I'm kind of inferring that this might be a question about like ADHD medication, stimulant meds like Adderall or Vyvanse and something like that. The psychostimulants, as you can hear, stimulant, it makes you think of having something excited, make you do more. But for people with ADHD, it actually has an opposite effect. So it actually calms them down and makes them think better and think more stably, I guess. So in long-term studies, they have seen some people who may have ADHD as children, and long-term, they may not need medication or not as much, because they're either two hypotheses have come out. One is the adaptive function, where we adapt to what's going on. So we actually make use of the hyperactivity to make us even more productive at work, right? So we're transforming it into something that's pro-social or acceptable. And some people still need medication to help them just to organize their day. So it really depends on the person. Another question just came in, which is, have I noticed a spike in the use of opiates among adolescents? Pain meds equals addiction. Yes. And actually what's even more concerning is not just the pain meds that's leading to addiction. I mean, that's of course if we talk about gateway to full-blown heroin or opiate addiction. But if people go from getting prescription medications and they go to, because they can't afford it or because their insurance don't pay for it, then they may resort to buying it off the streets. They may start off by buying the pain meds. But if you recall the previous slides where it has the kind of the equilibrium of effect of drugs, that you build a tolerance. Another good example is, if you drink coffee in the morning, a lot of people probably take like a small sip and they should be fine. And over time, you feel like you could probably drink 2 or 3 cups before you actually feel awake. So with regards to kids or people who turn to street drugs, and it could still be the pain meds because they are sold on the street as well, but it's at a higher price. And so people tend to resort to using the more illicit drugs, like heroin, for example. It's cheaper, readily available, and it gets you even feeling better than the prescription meds per se. But what we're also finding out, and this is what's the alarming part, is that the drug dealers are actually lacing it with fentanyl to make it even more addictive and making sure that they have a repeated customer. So those are some of the things that we're seeing, and it's really obviously very problematic. So some of the questions that are coming in, and I appreciate how many questions are coming in, because how I translate that is that you guys are being, I guess, your red regions of your brain is being fired, and you're thinking and asking these great questions. But I'm going to try to keep moving, and some of them may be covered in other slides, and if not, we'll definitely cover it at the Q&A. But I don't want to discourage you from asking these questions. Please continue to ask questions, okay? All right, so let's continue. In terms of looking at the DSM-5, so that's the Diagnostic Statistical Manual. These are the criteria, okay? So there has to be some impaired control, and there's actually 11 elements that a person has to, or I should say, there's 11 criteria that a person may possess to qualify to have a substance use disorder. There's 3 categories. There's a mild, there's a moderate, and a severe. And each of the categories depends on the number of criteria a person meets. So the less criteria you meet, you might be in the mild. The more criteria you meet, obviously you'll be in the severe. So just a quick kind of illustration of how it works. There's some effect to the social impairment. Risky use. I mean, obviously, you're probably sitting there thinking, well, all use is risky. Well, risky use is also putting yourself in harm's way, like driving while under the influence, or going into a bad neighborhood to pick up some drugs, or stealing and selling your stolen items to make money so you can fund your drug use. and then the pharmacological criteria. Okay, so I'm going to go into each of these areas and kind of point out some of what qualifies for somebody who may have a substance use disorder. Under impaired control, a person may take a substance in larger amount than they intended to, over a longer period of time than originally intended, spend a great deal of time obtaining, using, or recovering from the effects of substances, an intense desire to use or urge to use. So these are all about the impaired control, which means that you obviously can't control your urges or your cravings, right? Okay. Social impairment. Some examples of that are failure to fulfill major roles, obligation at work, school, or home, continued use despite negative consequences to social and interpersonal issues, giving up or reduce important social, occupational, or recreational activities. And I share this because, you know, some of you guys, well, I think most of us are parents, and some of us have have children that are, I would say, drug curious age. So this is the time that you want to see if there's any deviation from their norm. And at the age of the adolescence, the most important thing is their support system, their social network. So obviously, if you see that there's some changes in their friends or their type of friends, those are times you might want to start looking into maybe asking more questions, being more mindful or more observant of what's going on. So just a quick thing. Risky use. So continue use despite physical safety. I kind of mentioned that earlier. Continue use despite physical or psychological problems. And just as a quick little tidbit, and this is something that's coming out more substantiated in that more states have legalized marijuana use, and there are more studies confirming that early use of marijuana actually brings on an early onset of schizophrenia or some psychotic disorder. So if a person may be predisposed to a psychotic disorder, marijuana would actually bring that to light quicker and earlier in their developmental stages as opposed to later in life. Some people may have that predisposition but never even have that gene expressed, so they may never be schizophrenic or have a thought disorder. And then and if you use drugs, obviously you diminish that chance of it be never to show itself. So let me just look at, there's a question here or a comment, changes in friends. Doesn't necessarily look bad. Significant usage in high achieving teens. Okay, thank you. I appreciate the correction. And I hope that you don't think I'm suggesting that changes in friend is necessarily a bad thing, but definitely something to kind of keep an eye out. And the type of friends that they hang out to will also be of concern or can be of concern. What age of teens use marijuana? And actually, I'm going to go to that in a few slides, and I'm going to refer to the youth survey that Fairfax County Public School put out. So I'll answer that as we go. And the pharmacological criteria. So we kind of talked about tolerance. That is, you need to use more to get the same effect, or the amount that you use don't give you the same effects, right? Withdrawal. So every substance that we take in has a withdrawal or some kind of side effects. And an example would be if you are a coffee drinker and you stop drinking coffee, the most typical withdrawal is a headache. You'll feel irritable. You'll be less patient. And the interesting thing about drug use, and that again includes alcohol, the withdrawal symptom is actually the opposite of what you're trying to mask. So for example, if you are feeling depressed and you want to drink to get out of that depression, the withdrawal symptoms will be once the alcohol leaves your system, you will feel more depressed. So you can start seeing there's that vicious cycle that starts to manifest itself, right? All right, so some of these next slides I'm going to go really quickly because I was assured that you will have access to the PowerPoint. So some of the slides that I have here are more informational as a reference point, so I'm not going to spend a lot of time. But I did try to put it in order in which our students may experience most, or young adults may try most often, and then the latter ones you'll see why. So this is alcohol use disorder. I have each of the substances that they may develop a disorder to um, in two categories: what the intoxication may look like and what the withdrawal potentials may be. And I have this so that you can see, you may not smell alcohol in their breath, but you might see all these other symptoms or indication that they may be under the influence. Now, obviously, we have to also take into consideration medication that they're taking and how it might be affecting or, affecting each other if they're taking multiple medications, as well as any other medical conditions that may be underlining this. So if you have any suspicion of some abnormality, I would recommend going to the doctor to rule out that there's no physical contribution to their current situation. And then once you can rule that out, then you can start looking at behavioral health, which is, is it a psychiatric condition that you're starting to see, or is this a substance use disorder that is coming out, okay? So again, I'm not gonna go too far into the alcohol use disorder, but just to let you know that there are the intoxication withdrawal signs and symptoms. So these are some stats across the nation, and I thought it was interesting to see, and this is 2015, so I definitely need to update this a little further, but alcohol use among youth between 12 and 17, this is a national survey. And in 2015, there were an estimate of 623,000 adolescent ages 12 to 17, that's 2.5% of the population, had an alcohol use disorder. So now, one thing I want to just kind of point out there, and the 2.5 may seem, well, it's not that big, but alcohol use disorders, you have to have fulfilled those criteria that we talked about earlier. And we're not even looking, is it a mild, moderate, or severe level of disorder? A use disorder like this is indicative of some addiction. It's not just a misuse or just, kids experimenting. This is a full-blown addiction. And then it's also interesting, it's almost a even split. 5.1% are males and 5.3% are females. So don't think our girls are safe from alcohol addiction as well. In terms of underage drinking, 7.7 million people ages 12 to 20 now. So the range is a little bit bigger because the legal drinking age is 21. 20.3% reported drinking in the past month. Again, the percentage between males and female are almost exactly the same. Okay. So I'm gonna, again, just kind of go through quickly in terms of looking at some of the consequences. This is an estimate of 88,000 people, 62 of them are men, 26,000 are women, die from alcohol-related causes annually. That makes it the third leading preventable cause of death in the United States. And probably not too surprising, the first is tobacco, and the second is poor diet or physical inactivity. Right? All right. All right, so let's go into the Fairfax County Public School Youth Survey. The latest one that I was able to see was the 2017-2018. And this is the percentage that they broke out. So 8th graders, 10th graders, and 12th graders. So they did it every 2-year grade-wise to do their survey. So these are all the students in Fairfax County Public Schools. So 8th graders, 3.5% of them have used alcohol in the past 30 days. And in parentheses versus 8%, and that's the national average. So that's a good thing, right? That's a good indication that our kids are not on the same level as the national average. But this is where kind of think about how our brain works. This is us rationalizing that, hey, it's okay, it's not so high. But would you have the same sentiment if your kid was one of the 3.5%? So I know I can probably sound too rigid on this, but probably 0.1% is more acceptable for me than a 3.5%, right? So you can see the percentages there. I'm not going to necessarily read it to you. And the other thing that is important to see is that the trend increases with the age or grade that they go to. So by 12th grade, they've gone from a 3.5% to a 29.5%, okay? And then I don't have the numbers, and I didn't look for what college students, percentages of them would fall into the alcohol use within 30 days. So again, you know, as you are ready to launch some of your new freshmen, those are other concerns to have as well. Alcohol binge drinking. Binge drinking is drinking a lot within a small period of time. And for most people, the intent is to get drunk, right? So these percentages is the breakdown as well for the 8th, 10th, and 12th graders. And this is where I think is important to kind of throw out there. Okay, quick question. Are any theories to why females are higher? I don't necessarily have, what should I say? Any undisputable data or research to support these. So I'm just gonna base my theory for me. And I believe it is to feel like they are part of a group, like like to be cool, that females may want to drink more than males. That might be one possibility. Another possibility is the stress that they may feel that they're under as a female in school. So just my theory. All right, so let's go back to the parental perception of alcohol use behaviors. The blue represents no alcohol use, and the yellow is yes, alcohol use. So you can see that for parents who feel that it's very wrong to use alcohol, it's a higher percentage, right? And for when they feel that it's not so wrong, then they allow 53% of our kids to use alcohol. And just in case we were thinking about wanting to be the cool parents, Virginia actually has a law against hosting alcohol parties. Some parents may feel that, hey, at least I can control the environment, it's safe, they're not gonna drive, so on and so forth. But even that is illegal, and obviously it's illegal because we don't want to encourage the delinquency, contributing to the delinquency of minors, right? So again, something to think about in terms of parenting. Is this something we want to send a message that, hey, I'm cool, I'm okay, I think it's all right that you can drink, it's a phase. And we don't know if the person, your child, has a genetic predisposition to alcoholism, right? If you were to trace your family heritage and see that there is a history of alcohol, that would be something that you would want to be cautious about going into it, all right? Okay, so I'm gonna, again, kind of breeze through cannabis use disorder. And so earlier the question was, when do kids use marijuana? So this is, again, the same survey. So in 8th grade, 1.9% of our kids have used marijuana in the past 30 days. And no surprise, it escalates to 17.9. And then the difference between males and females is significant. It's 8.3 for females and 10.4 for males. Some of you guys may or may not be aware of synthetic marijuana. That's spice, K2, stuff like that. And a lot of the teens turn to that because they can buy it from convenience stores or mom and pop stores like that. It's marketed as a potpourri, but I guess through word of mouth, they know they can abuse it and get themselves high. There's actually more studies showing that the people who are using synthetic marijuana are having acute psychotic disorder or psychotic break. And they're also having an increased visit to emergency rooms. So those are things that we definitely have concerns about. And the DEA has not put it on a schedule ban list, but it's definitely one of the substances that are being banned, but not as a scheduled drug, if that makes sense. All right. Another question is, to what extent does genetic predisposition increase alcohol addiction rates? Now, that's a really great question. And I don't know if there's a hard science that says, hey, if your uncle twice removed was an alcoholic, that you have an X percentage. What I can safely say and confidently say is that there's an increase, a likelihood of somebody developing alcohol use disorder with a family history of alcoholism. Now, that doesn't mean, like if my dad was an alcoholic, that means I'm going to be an alcoholic. I mean, it's all genetics, right? It may not translate to me. And then it goes into the debate of nature versus nurture. If you're exposed to it, will you become addicted to it, or is it biologically caused? It's kind of interesting. All right, so we talked about inhalants. This is the thing that most people don't realize, but inhalants is really the gateway to drug use. Not alcohol, not cigarettes, but inhalants. And 8th graders reported 2.1% of them had used inhalants in the past 30 days. And this is the one thing that's interesting, is that the trend is opposite every other trend, which is it decreases as you get older, because obviously they're replacing it with something else.
I think the crux of where we really want to know, and again, you have the PowerPoint, so you can have all the other resources and information. But the crux of this session is, how do we break that cycle, right? How do we disturb the circuitry? And the question everybody asks me, parents, clients, family members, is there a cure? And the short answer is really no. And it seems a little depressing to have that as an answer, but there's still hope. And the hope is that we are trying to ensure that, we can help them regain as much of what they have had before beginning drugs or alcohol use. So the way that we will disrupt the circuitry is really, if you think of ABC, so hopefully that will help remember. A is what you guys are doing right now, which is to raise your awareness and to understand what is going on and how you can help your loved ones, right? So getting the facts, being informed, and that's both ways. You as the parent, the loved ones, what have you, as well as the individual that is dealing with the addiction. Know where to go to get help. So if you're in Fairfax County, I would recommend coming to Fairfax County Community Services Board. You'll be assessed there, and if you meet the criteria for CSB services, we'll definitely get you connected to our residential or outpatient programs. If you don't qualify for CSB services, we will also give you resources and refer you to other available private community partners. And then if you can, I would recommend getting trained in Revive. It's like getting trained in CPR. It can be a lifesaver, especially if you have somebody who is using opiates, or you suspect somebody's using opiate. The one thing, and I can share this real quickly in terms of the Revive, is that if somebody is in a physically compromising position, and you think it might be opiates, you can administer the naloxone, and if it isn't an opiate overdose, it won't hurt them. So that's a good thing. You can't do wrong by administering naloxone. And then the B, being, and not just acting, but the being. And what I mean by that is being patient with your family member or loved ones. It can be very frustrating. It can be very taxing, but to try to be patient. And what I mean by that is, the person that we're trying to help may not see that they have a problem yet. So we have to, again, going back to the A, helping them raise their awareness so they can start seeing, maybe, just thinking maybe there's a problem. So we have to be somewhat patient, but then at the same time being persistent. Don't give up. Keep at it. Now, of course, there's a way to do it versus another way, and we'll talk about that a little later. And then as for parents, be parental, right? It's okay. And it leads to the C, which is being able to set limits or set consequences. And I like to kind of phrase it as using caring consequences, because sometimes there's a negative connotation with the word consequence. So if we can do it in a caring manner, I think that can help send a message that we want them to get better. We want them to recover, stop engaging in the self-destructive behavior of drug or alcohol use. And then under caring consequences is don't be afraid to impose consequences. You probably have heard of tough love, and that's kind of where this is going with. And the notion of love setting limits versus setting limits with love. So is it tough love, or is it one of the other things? Setting limits with love, meaning that it's caring for them while you're still setting the limits. A lot of time, people aren't going to change until they are at an impasse, or that they're tired of the way it is. So we have to kind of help encourage them to find that impasse, and the limits will help that. Okay. And this is a slide where I like to show, in terms of just our natural body chemistry, the natural way our body heals. The longer a person is abstaining from their substances, whether it be alcohol or drug, the brain, again, about the elasticity, will bounce back. So this is an illustration of what a person who is using methamphetamine might look like compared to the controlled substance. So a controlled population, sorry. So after 1 month of sobriety, you can see that they have some red starting to come back. So they're starting to have a little bit more of a clear thought. And then after 14 months, you can see how much more vibrant the red is. There's more activity in other regions of the brain. And again, with regards to certain drugs and alcohol, there may be some physical damages to the brain, but luckily we have two hemispheres within the brain that can compensate for some of the deficits, or in this case, the holes that drugs and alcohol may have caused. And then other ways of disrupting is looking for motivation. What is it that your loved one, your family member, really can find more pleasurable than the drugs or alcohol, right? Prevention is very important. That's why it was so important for me to share with you how early kids can start experimenting on drugs and alcohol. So starting off with educating. One of the things that most people are afraid of is, if I bring it up, maybe I'm encouraging it. And that's actually not the case. And to kind of not raise the awareness, that actually could help them become more curious, because then they're looking to their peers to see what's going on. SBIRT, or SBIRT, is an acronym that stands for screening, brief intervention, referral, and treatment. So that's part of the prevention model. And again, we have that at our CSB, and there are several other programs in the community that provides the quick assessment, quick intervention, and if necessary for longer term, they'll make a referral for treatment, okay? And keeping your family member connected to primary care, because we kind of mentioned earlier, to make sure you tease out, is it a medical condition or is a substance-induced condition that the person might be exhibiting. And then in terms of intervention, ASAM stands for the American Society of Addiction Medicine, and there's 4 levels of care that they describe, from 1.0 to 4.0. 1.0 would be something like outpatient level of care, where a person may go once a week, maybe for a couple of hours. It's any level of care that's less than 9 hours. And then 9 hours or more, you would be going in toward like the intensive outpatient or the partial hospitalization program. 3.0, meaning the 3.1, 3.3, 3.5 are residential programs. The 4.0 is a hospitalization. So somebody who is medically compromised and need medical attention to help them detoxify from their substance use, that would be a hospitalization. A 3.7, which is detoxification services, is kind of the lesser of that intensity, but we also, as a CSB, we also provide that service as well. Under intervention, we also have medication-assisted treatment. So sometimes people may be using drugs or alcohol to self-medicate a mental health condition that they neglected or ignored or denied. So as they clear from their substances, we might start seeing other symptoms of psychiatric conditions. And that's where we could bring in medication-assisted treatment to help them continue their recovery and ensure that they're doing well. And then, of course, finding the support system. And it could be a sober network like AA, NA. And one of the other questions I remember reading is that, what can the family member do? And I would recommend strongly that family members attend Al-Anon groups. And Al-Anon groups are a collection of individuals that have family members who are experiencing substance use disorder, and they're getting support for each other. They're sharing resources, and they're helping keeping the family member accountable, and then in turn keeping the person with the substance use disorder accountable. So those are some of the things that I would recommend in terms of looking at how to disrupt the circuitry. But the best solution is the longer they can stay away from the substance, the better they'll be. They'll start thinking more clearly, they'll make better decisions, but it's not just an individual change process, it's actually the entire system. And when I refer to system, I'm talking about the individual as well as the family or their partners, what have you, right? So these are some of the programs that our CSB offers, and I kind of alluded to earlier, and not to go too far into it, but we do have services for both adults and youth, and a large component of our service is also a family component, because that's how we can really ensure some sustained change. Okay. These are additional resources that you might want to take down or at least keep in mind in terms of our entry into services. We have our entry and referral services. We have our DSOC center, which is 24/7, 24 hours a day, 7 days a week, 365 days a year, as well as emergency services. So obviously when somebody's under the influence, if they're feeling trapped or distressed, they might be more likely to act on impulses that might not be safe for themselves or someone else. So emergency services, also a 24/7 type of program, can assist with that. Okay. All right, so I'm going to go ahead and stop this screen share, and let's hear some questions.
Great, thank you so much. I'm glad that we got to hear the end of your presentation because I felt like it really brought everything together.
Thank you.
So let me start. Oh, sorry about that. Let me start with the first question. So how can I, as a parent, help my adult child substitute healthy coping skills instead of going back to unhealthy coping and drug use?
Right. So that's a really good question, and it's not such an easy answer to necessarily lay out because it's so, and we try to treat each individual that comes into our program as an individual. So we don't want to do like a cookie cutter approach, but to kind of generalize and answer the question, what I would recommend, kind of going back to how do you disrupt that circuitry, is helping them develop a period of abstinence or at least stop using. And you might be able to use your loving relationship with your family member to encourage them, hey, why don't you, instead of using every day, why don't you use every other day? Or why don't you challenge yourself and let's see if you can go without using for a week. And in that process, we're trying to engage them into some change. And that's a harm reduction model as opposed to a full abstinence model. And we want to try to create some buy-in. So you want to look at what the family member, your loved one who is dealing with addiction, what they're able to do in addition, in context of not using the drug. So if you're telling them to stop one thing, one of the things that most families and providers forget is we have to substitute what they're giving up with something else that they find enjoyable, and it might take some time because what was enjoyable before was replaced by a much more enjoyable thing, drugs or alcohol. So now we're having to have them go back to something not as enjoyable. And early recovery is really difficult because most people have a hard time maintaining while they're in early recovery. And that's usually when we see a lot of relapses. But when they do relapse, it's not a time of giving up. It's, again, going back to that being persistent and being patient. And allowing them to kind of go through and then helping them see that there are other options. But in terms of some specific examples of what you can do to replace the drug or alcohol, I would say do more family activities. a lot of our clients, when they come in, they're struggling to recover, and they're doing a great job. They're beating odds that may not be in their favor, and then they achieve abstinence, but then they go back to their family or their partners or what have you, and nothing has changed. So because of that, they might get into the mindset of, well, why did I have to go through all of this if nothing has changed at home? So we want to encourage that the recovery is not just an individual stance, that it should be of a family or a couple or a system approach. So that way it's reinforced many layers as opposed to just one person. I know it's not the best answer, and it's hard to give you a specific answer when it's can be so applicable to so many different people with so many different circumstances. So that's the best I can do for now. So let's try another question.
Sure. And we have time for just one more question, but I feel like this is kind of on the same vein. You just spoke about how family and having a support system is so important to help get through these trying times. So here's a question that this person needs a little bit of help. So they said, I've noticed that my partner is spending more time with friends that I don't know, and has been less interested in spending time with family. Should I be worried?
Again, kind of going back to the earlier slides, I said that typically some of the characteristics to look for when people are starting to engage in unhealthy behaviors, especially with adolescents and even adults, right, is the changing of that circle of friends. Going from a group of friends that you may know really well, or you know them as being helpful and healthy, supportive friends, to now we don't know what's going on, who they are, what have you. Now, I wouldn't say jump to the conclusion that this person has an addiction issue, but I would actually want to try to find out more. And I guess the best way, again, you don't want to push the person away. You want to gently come into their world. And the best thing maybe is to invite yourself to some of these gatherings and see what these friends are like. If you have a chance to speak with them, that would be an opportunity to find out whether these new friends are, healthy choices versus unhealthy choices. And then at the same time, if you're having doubts, I would recommend going to Al-Anon, because then that's when you begin your healing and get to create the support around you so that you're not going to be duped by your loved ones in terms of what they're doing and then how they kind of excuse that behavior. So the healing has to happen from both sides. So I would recommend being active in that person's life rather than being kind of reserved or surrender to it. And then find help for yourself and go through Al-Anon, maybe go to a counselor for yourself, whatever works, use it. So that's it. If there's no other questions.
Yes, thank you again so much for presenting earlier today and for also hopping back on so that we could finish your presentation. We really appreciate you being here and helping to build the knowledge in this community on addiction and how to overcome that. So I hope you have a great afternoon.
Thank you so much, and thank you to you.